Who are the ad watchers? We are attorneys at the National Advertising Division of BBB National Programs, a team with over 50 years of experience investigating and resolving disputes over the accuracy of national advertising campaigns.
We don't just take ads at face value, we put them to the test. Why? Because advertising law can be simple, but it's the execution that's hard.
Welcome to the Ad Watchers, NAD's podcast that gives a view into how our organization reviews claims and applies advertising law. If you missed any of our previous episodes, don't forget to check them out later. They're available wherever you're listening to this. So, on this episode, we are continuing, as we are in this season, focusing on different product categories and the kinds of product categories we've seen a lot of lately at NAD, and try to give you a range of cases and a glimpse into what we are seeing for these products and what kind of cases we're seeing. So, Annie, what are we talking about today?
Today, we're going to talk about some of our infant care cases. Remember when your sons were little, Eric, those sleepless nights and wondering what products you needed to get through those
How could I forget?
long days? So we're going to look at, sort of three buckets of categories: infant formula, diapers and wipes, and also devices, so specifically monitors and bassinets. And we also looked at a case that looked at breast milk containers.
So let's start with formula, because I guess you have to feed them. Feeding very important of the part of the infant care regimen. They need to be fed, and there are a lot of different options for formula these days. I think that's a theme we'll see. We have more sophisticated, more diverse options, and all kinds of products in this area. But let's start with formula, because we had several of these cases recently and over the years. So this is a competitive category that we see at NAD. Last year we had a case involving an organic infant formula manufacturer who sold products under the brand name Kendall Mill. This is an imported product, and they were challenged by a competitor in one case over several kinds of claims they were making. First, there were some claims about the natural content of the product and natural ingredients. There were some images and phrases used on the packaging and on the website, portraying a pastoral setting with images of nature, and then claims like wholesome by nature, natural goodness, creamy whole milk and lactose from grass-fed cows. So we took a look at those claims, and NAD found that in the context in which the words and images appear, the advertiser was not making unqualified, all natural claims. So very important. If you're considering what kinds of ingredients, NAD here said that in the context, it was clear which ingredients they were talking about were natural and which would not be considered natural. There was a specific emphasis tied to the particular natural and minimally processed ingredients. Next, we looked at some claims where the advertiser had portrayed their product using the word clean, which we see come across in different product categories. Here, they talked about having the most clean formula on the market, or having clean recipes. They argued that this was puffery. But NAD said that these claims were not supported because it was unclear what standard was being applied, positioning the ingredients as being clean ingredients. So it was unclear, and NAD found that was not supportive. Also, NAD said that the challengers' more nutritious claims did not have the required support. There was some data and information provided about nutritional qualities of the product, but that was not a good fit, NAD said, for um, making the kind of comparative claim about the product. They needed more specific data about the product as compared with other ones in the nutritional content. Now, what was interesting in this case, we also had some other claims that were addressed, and they were addressed by the National Advertising Review Board on appeal. This was a challenger appeal. The challenger sought NARB review over some of the claims that NAD had found substantiated, and these were claims relating to MFGM, milk fat globule membrane, which is an ingredient in milk that's important for cognitive development in infants. So NAD had found that the advertiser could continue to make claims related to its whole milk ingredient in the formula that naturally contains MFGM and its association with cognitive development, and claims that its formulas do not contain specific oils commonly used in its competitors' formulas. So the challenger took these up on appeal, and the NARB agreed with NAD's conclusion and found that the claims, what we do is grass-fed whole milk and lactose sourced locally from European family farms with naturally present MFGM, with the addition of HMOs, dual prebiotics, and plant-based DHA and ARA. That claim, and then whole milk fats are similar to those found in breast milk with naturally occurring MFGM, supporting cognitive development. NARB agreed that those claims were supported. The one interesting part of the NARB's decision, I thought, was that the panel looked at the audience for these claims, and they said that consumers of organic infant formula are relatively sophisticated and discerning and will not misunderstand the information about the Kendall Mill products. So that the consumers would reasonably take away a supported message about the MFGM content and its link to cognitive development support. So there was also another case involving the same advertiser, Kendall Mill, and I think I just mentioned that one of the claims had to do with locally sourced ingredients from European farms. That was an issue in another case involving the same advertiser. They, on their package and on their website, they had used a symbol, a blue flag with 9 stars arranged in a circle. Annie, do you know how many stars are in the European Union flag? The flag used by the European Union?
There are 12.
Correct. And do you know what those stars are meant to symbolize?
They're actually not meant to symbolize the countries in the EU, but they are meant to. I think they are meant to symbolize the different principles, right? Like specific the ideals of unity, solidarity, and harmony among
Oh,
the
you looked
people
that
of
up.
Europe. I did.
So you knew I was
But
going to
I
quiz
knew
you.
about the I knew already knew about the stars.
So 12 stars, in part representing, like the 12 months of the year, a perfect harmony. But this is a podcast about advertising law and not flags. I'm sure one of those exists. But I thought this is an interesting case. So they had this symbol with 9 stars that resembled the European Union's flag that they use of 12 stars. And it was on the packaging of the of the formula. And there were references to the product being European in origin or sourcing ingredients from European farms. Now, in fact, or to be specific, the product is a product of the United Kingdom, which, since Brexit in 2016, is no longer a member of the European Union. So the question was there a unsupported message being conveyed that the product is a product of a European Union state rather than the United Kingdom? NAD took a look at it, and I've learned a lot about flags during the course of it. We said that the symbol that they used was meant to convey something more general about Europe. Now it's a little more flag trivia. Um, there is the flag used by the European Union is not limited to use by the European Union. It is also the Council of Europe flag, and a flag meant to represent Europe more generally. So it didn't necessarily exclude the United Kingdom. Also, the United Kingdom, the product was identified as being a product of the United Kingdom. Elsewhere on the package, and there was no express claim that the product was a product of the European Union or another member state of the European Union. So NAD said that was fine to use that European Union-like symbol on the packaging, but caution that in other contexts, the advertiser might need to be more specific about the origin of the product and clearly convey that message. Okay, so still some more formula. We've also seen number one infant formula brand claims, in case involving Abbott Nutrition from a couple years ago. I'm not going to talk about that one because it was voluntarily the claim was voluntarily discontinued. Annie's going to talk a little bit more about number one claims, but we do see those in the infant formula market. And then lastly, babies can be very expensive. So we've seen price claims involving infant products and infant formula. So we had a case a couple years ago, and the advertiser was Perrigo. Perrigo sold a brand of formula that was for a more cost conscious consumer. So they made certain savings claims, and NAD said that their store brand hypoallergenic infant formula costs less, allowing families to save at least 22% compared to leading name brands. That we said that claim was supported, and that they had support that base for the sales and the pricing, leading to that 22% savings claim, and also that it was nutritionally comparable to the leading name brand hypoallergenic formulas. There were also some monthly savings claims. I won't get too deep into those, but those were supported, saved a good amount of money there, except when they took the claim a little bit further and made a comparison that it would also help cover the cost of diapers, also expensive. But that claim was not supported. That part of it was not supported. And then finally, when they talked about affordability, we said that they could make claims about general affordability, generally being more affordable, as being a more affordable option. But then at times we said certain claims went further in conveying an unsupported message of broad equivalence between generic hypoallergenic formulas and brand name hypoallergenic formulas. Certain of these claims, like you can't put a price on health and nutrition, but there's no reason to pay a premium just for the name on the label. those conveyed a broader unsupported message.
So, what goes in must come out. So, let's discuss diapers and wipes. So, as Eric mentioned, we see a range of issues, and they touch on performance, green claims, in this case, a biodegradable claim, and number one claim. So, let's look at diapers. So, absorbency and fit are perennial issues. In a challenge brought by P&G against Kimberly Clark for its Huggies diapers, they challenged a number one best fitting diaper along with demonstrations of fit. And for the number one best fitting diaper, uh, it was not a line claim on the website because they talked about specific products, but it was in the videos because of general Huggies references. Now, as for the fit between the claims and the support, pun intended, it was not a good one because the study didn't measure or compare overall fit. The measurements were also not done by an image analysis. They were done, hand and eye by actual people, and so the measurements were not as precise. Additionally, it was not gender proportionate, so it was mostly baby girls. Also, the diaper in some instances was not fastened properly, so we recommended that the claim be discontinued. As for the demonstration, while the display of the two diapers side by side didn't convey a superiority message on the advertiser's website, they did in the commercial, because there was a reference to only Huggies has the most curves to fit your delicate skin. Uh, so we recommended that be modified to avoid conveying the message that the Huggies have a superior fit due to having more curves. Now, turning to absorbency, we've had cases, brought by larger competitors against smaller ones, and as always, NAD tries to ensure that there is a level playing field, and all advertisers have to abide by the same rules. So some of the claims we saw were quantified performance claims, and so it's really important to have reliable, consumer relevant data that closely matches the claims. In a P&G challenge of Rascals advertising, they touted claims such as up to 25 times its weight amidst claims like engineered with six core innovations for a high performing diaper. That means fewer blowouts, less mess, and less stress for you. And that emphasized real world performance. But the problem was that the testing was flawed. So, in addition to not providing the actual study, there was a dunk test performed there. And so that's really a torture test that does not show real world performance. A torture test might be fine if you've got, for example, very high performing products and you're trying to tease out a difference between one versus another, but certainly not to support this quantified performance claim. In P&G's challenge of coteries advertising of up to 4 times absorbency and 3 times drier skin over the leading brands, the advertiser's testing was not materially flawed, but the challenger's testing was more reliable, and the performance benefits only related to some diapers and some certain number of products in every box or package. Well, the up to standard requires that an appreciable number of consumers are able to obtain the maximum claim benefit, and that just wasn't the case here. Uh, so the claims had to be discontinued. And lastly, for green claim, specifically a biodegradable claim, that we saw that in a challenge by Kimberly Clark against Diaper, and there they were making biodegradable claim. Now, we try to harmonize our decisions with any relevant regulatory authority. So in this area, it's the FTC's green guides, which make clear that for biodegradable claims, you need decomposition in within 1 year, and it can't be an unqualified claim. Well, in this case, it was qualified, and some components of the diapers were biodegradable. but they were disposed of in customary outlets for disposal, which will not biodegrade even in part. So the claim had to be further qualified to make clear the circumstances in which the uh, biodegradable diaper components would actually degrade. Now, turning to baby wipes, we had two challenges against water wipes. These are a little older cases, but still from 2022, but still good to touch on. And here we saw a number one claim, and in Casey's Kimberly Clark's challenge of water wipes, and it was number one wipe against the causes of diaper rash and clinically proven as number one against the causes of diaper rash. So that's a pretty impactful claim, isn't it, Eric, for new parents, right? Who are trying to find the best wipe possible.
Yeah, I would say that new parents are what we would call maybe a vulnerable population in terms of hearing advertising messages, because they are going to be impacted by anything that helps clean the baby up, helps put the baby to sleep, and give you that peace of mind. So that uh, it's just going to be very, and you want what's best for the baby at all times. So it's just always going to be more impactful than anything else.
Yep. So in this case, the study was a baby skin integrity comparison survey, or the BASIC survey, in which there were 698 mothers of newborn babies and babies up to 8 weeks old. And so they used one of three brands, and they all used the same brand of diapers. Now, while the water wipes group had the lowest reported number of diaper rash, the study had a number of flaws. First, the lack of control. So the parents were actually using lotions and ointments, which are confounding factors. There was also no blinding, and the babies were tiny. They were only up to 8 weeks old. And so it's a number one claim. It's impactful and communicates market wide superiority, and of course, clinically proven. Requires competent and reliable scientific evidence, and we didn't have that here, so the claim had to be discontinued. And then there was a challenge, another case brought by P&G, and they were touting purity and ingredient claims. And here the context, was really important. So in some contexts, the claims were truthful and they didn't convey superiority over other brands, but in others, they were reasonably implied that the ingredients in other brands were potentially harmful. There was like images like the stop sign, and so we said the advertiser had to discontinue the express and implied claims, including imagery portraying wipes as unsafe, harmful, or exacerbating diaper rash.
Okay, so our last set of cases, we're going to talk about new technology. Technology has really advanced in terms of infant products over the years, and we're going to talk about some of those products. First, recently, we had a case involving baby monitors. This was a fast-tracked Swift case, case 7544. The advertiser Nanette had a monitor that was being sold with the claim the number one baby monitor, also the number one smart baby monitor. And they got a challenge from a competitor, Owlet, who makes another kind of monitor. The Nanette product, the advertised product, is a video monitor, and it comes with it's an advanced video monitor, and it's Wi-Fi enabled and comes with all kinds of notifications and analysis and alerts, and tells you and gives you a video feed. So very state of the art, all the bells and whistles video baby monitor. And the challenger made a different kind of monitor, a medical device, which was called the Dream Sock, and it goes on the infant's foot, and it gives you real time and gives you information about the infant's heart rate and an oxygen level. So you're getting health related information, a sophisticated device that gives you health information, but it doesn't, but not necessarily that it did not come with uh, a video component. You could add one, but it did not come with a video component. So it was sold separately as a medical device. And so what NAD said here was that in substantiating the claim number one baby monitor, number one smart baby monitor, they should include uh, things like the Dream Sock, because that is also a monitor. The claim was not limited to video monitor, which may have been a different story. So the category of monitors has broadened out to include these kinds of things. And smart features are very common. You could call these all smart monitors um, because of the data that they're providing and the technology that's involved. And speaking of new technologies, of course, we've now seen claims about infant products that tie to AI, artificial intelligence. Um, so we've had a few of these cases, and these were a part of NAD's monitoring efforts into claims about AI, and uh, we commenced at least three of these, and two of them were heard on the merits, or were NAD addressed the merits. First, we had a case recently involving the Maxi Cozy bassinet, and so an AI bassinet with AI technology. So NAD looked at claims that this product had its um, groundbreaking cry assist technology that uses AI to translate your little one's cries, letting you know if they might be sleepy, fussy, gassy, agitated, or hungry, which is sort of an amazing innovation for every parent who's wondered what their child's cries mean and how can I fix them. Um, Now here, NAD. So NAD took a look at the evidence, the evidence that was presented, um, and the advertiser provided peer-reviewed, published research documenting and validating the underlying AI model, as well as evidence demonstrating calibration and performance of the technology and devices. And the data was also built on uh, research of how specific crying sounds can convey urgency and indicate the kind of distress. Um, that the child is experiencing. So you might know if a child's cry is a hungry cry, a tired cry, a gassy cry. This is supposed to help you. Um, and this had about a 90% accuracy according to the information. So NAD found that these claims were supported. NAD also took a look at another AI baby product. Here another monitor product, um, which was the Horizon brand's Tiny Traveler monitor, which was sold as an AI-powered smart baby monitor solution. NAD found that claim was supported based on the chip that they used being an AI, meeting the standards for AI. Advertiser also made claims here about being able to detect emotions, and based on whether the facial expressions of the child were crying, or were they laughing? So, is the baby upset or not? And the accuracy was not perfect. There were limitations on what this model could do, capturing the baby. So capturing what the baby was doing. So NAD recommended that they disclose the limitations of the baby monitor's ability to identify emotions. But there was some AI capability here. Also had some security claims that it had a virtual fence and had a stand detection, so to tell you when the baby was standing, and that it ensures the safety of the baby so you can rest easy. Looked at these being safety claims. Of course, we'd look at them with the highest level of scrutiny, and these kinds of really strong and unqualified messages about safety had to be modified or discontinue to disclose the limitations on what could be detected. And then you may be wondering, gee, aren't we collecting a lot of data about these infants? They're being analyzed and monitored, 24/7 with these devices. Might there be some privacy concerns? And well, it turns out in each of the last two cases I talked about, NAD worked with our colleagues at KRU and reviewed those companies' practices and claims for COPPA compliance. So that did not go unnoticed.
So, in conclusion, one thing that's important to remember is your audience. Infant products are directed to a vulnerable population. As Eric had mentioned earlier, parents, caretakers who want the very best for their little ones. So it's very important to keep that in mind when crafting messages. Words and images really matter.
And we're in a time of innovation. Innovation drives the marketplace and creates healthy competition. But remember to keep your claims in line with what the evidence is. Don't overpromise and underdeliver, especially to new parents.
And less is more. Piggybacking off of this, what Eric just said, really important to narrowly tailor your claims, and that's especially true when you're in the green space, and also important to provide all your testing. In some of the cases that I mentioned, we didn't see the full test or the underlying study. It's very important to provide that, and certainly where it's being provided confidentially. Confidentiality should be used sparingly, but certainly provide a robust summary for the challenger because it helps us in our analysis.
Thank you again for tuning in to this episode of the Ad Watchers. We hope you enjoyed it.
Join us next month for another episode of the Ad Watchers. As always, you can head over to our website, bbbprograms.org, to learn more about what we do at the National Advertising Division or any of our other self-regulatory programs. That's all for this episode. See you next time. Thanks again for tuning into Ad Watchers. Be sure to check out our previous episodes at accountabilitystudio.org, Apple Podcasts, or wherever you listen to your favorite podcasts. And don't forget to subscribe to get notified about our next episode.